Hi, Dr. Regan Roberson, CCO of Productive Dentist Academy here, and I have a question for you. Are you finding it hard to get your team aligned to your vision, but you know you deserve growth just like everybody else? That's why we've created the PDA Productivity Workshop. For nearly 20 years, PDA workshops have helped dentists just like you align their teams, get control of scheduling, and create productive practices that they love walking into every day. Just imagine how you will feel when you know your schedule is productive, your systems are humming, and your team is aligned to your vision. It's simple, but it's not necessarily easy. We can help. Visit productivedentist.com/workshop. That's productivedentist.com/workshop to secure your seats now.
Most practices get less than 50% of their cases accepted and get less than 35% of the dentistry that they recommend accepted, which was not acceptable to us.
Welcome to the Everyday Practices Podcast. I'm Regan Roberson, and my co-host, Dr. Chad Johnson, and I are on a mission to share the stories of everyday dentists who generate extraordinary results using practical, proven methods you can take right into your own dental practice. If you're ready to elevate patient care and produce results that are anything but ordinary, buckle up and listen in.
Welcome to Everyday Practices Dental Podcast. I am your host, Regan Robertson. Dr. Chad Johnson today is en route traveling to Miami for some very special CE work. And congratulations on that, Chad. We appreciate you continuing your education as always. Back at the home office, I get to have a lot of fun today. We're talking case acceptance. That can be a bit of a sensitive topic. We can be really excited about it when it's going the right way, or we can feel a little defeated if it's going the wrong way. So part about Productive Dentist Academy, as we all know, is we provide ways to work smarter, not harder. And it is my absolute honor and excitement to share that we have a full house today for you, talking specifically about case acceptance. In the chairs today, we have Dr. Edmund Liu, the owner doctor of Clarksburg Dental Center. We have Cierra Johnson, the wellness coordinator and front office lead at Clarksburg, and Oliver Gelles, the CMO of AcceptCare. If you've never heard about AcceptCare, get ready. You are in for a treat. So welcome everybody to the show.
Hello.
Thank you, Regan.
Absolutely. So Dr. Liu, I have been poring over your 5-star Google reviews, which you have a cornucopia of, and your patients really, really highlight you for being an attentive doctor, for your staff being amazing, for the TVs that you have up in your ceiling, which you told me before we started recording that they're just $150, but they bring a wow factor. So I'm wondering, Dr. Liu, can you tell us, be our eyes and ears, tell us about your practice, your location, your service mix, your history, all the good stuff.
Yeah, sure. So I'm Edmund Liu. Our office is Clarksburg Dental Center, and we are in Germantown, Maryland, which is about 45 minutes from Baltimore, Maryland, about 45 minutes from DC. Yeah, and there are 2 doctors in our office, me and my cousin, Ken Lin. So we started our office from scratch about 17 years ago in 2006. Time flies.
It sure does.
Yeah, so we started with a team of 4 people, 2 of us, the 2 doctors, and then 1 front office, and then 1 assistant. And now we have a team of 12. So we have grown quite a bit in the past 17 years. And as far as the service mix, I would say we are a pretty typical general dentist office. We do a lot of bread and butter dentistry like crown and bridge, fillings, composite, scaling and planing. We do some single tooth implant. We do Invisalign, and we also do Lannette, And for those people who don't know what Lannette is, it's an amazing service we provide for patients. It's you call it laser gum therapy. Yep.
Lasers are, that's a whole other podcast in and of itself, Dr. Liu, isn't it? They're just, what they can do today blows my mind.
Yes, yes.
And I
Oh,
think Lenap's been around for how long? Over a decade, right?
yeah, actually almost 20 years. Yeah.
Yeah, that's what I thought. Yeah. I've been with PDA for 12 years. So that's the extent of my dental history. And I remember when I joined the industry, I was lasers where I thought, wow, this is like sci-fi nerdy goodness that I didn't even know existed.
Right. I always share with people that I think that the three most amazing things that have happened in dentistry in the past, 20, 30 years are, first is dental implant, right?
Yes.
Second is Invisalign. And
Yes.
is Lanet. Yeah.
So you brought them all into practice.
Yes, I had to.
That's smart. We call that being authentic to yourself and following your passion. So, with all of these services that you are really passionate about providing and bringing in, at what point did you turn kind of that keen eye towards case acceptance? Because having the ability to do the dentistry is one piece of the puzzle, diagnosing is another part, and then case acceptance is a whole other ball of wax. So, when did you start to pay attention to that as a metric in your office?
Yeah, that's a good question. I would say about about 8 to 10 years ago, we started paying more attention at case acceptance. When we first started our office, we signed up with every single PPO plan in the world, right?
Yep.
And in about 3-4 years after the startup, we got so busy, so busy to a point that we were putting a lot of focus on just fixing broken teeth. Patient come in with a broken tooth. We treatment plan it for a crown, and then we fix it. And that treatment case acceptance was very easy back then, because patient already knew that he needs the treatment, or he or she needs the treatment. And with the PPO fee, it's so much lower than the standard fee, right?
Mm-hmm.
So the out of pocket number is a lot smaller, and the patient would feel like, can afford it. Yeah, much easier. But about 8 years ago, we put more focus on comprehensive treatment planning, and also we started dropping PPO plans. Right. So those two major changes, definitely, make an impact on the case acceptance. Because, the same patient can come in with a broken tooth. And then we do comprehensive treatment planning. It takes a lot more to educate the patient so that they would understand, they need more than just a crown. They might need 2 crowns and 2 fillings, and scaling and root planing. And it just takes a lot more to let them understand that they would benefit from the treatment that we recommend. And then also, the out of pocket expense will be a lot higher, right? I mean, we can go from $400 for a single crown to $4,000, for a comprehensive treatment planning.
Right.
Yeah, and when we have that, the case acceptance just became a lot more challenging.
You mentioned the word challenge, and there's 2 ways to kind of approach a challenge like that. It's either with optimism, I'm going to try all these things, or it's frustration, and I just don't know what to do. What was your process, and what did you try before you sort of figured out what worked best for you?
Yeah, so I think there are so many determining factors on case acceptance, right? But personally, I think there are the 2 main determining factors on case acceptance. The first is, whether the patient thinks that they would benefit from the treatment we recommend. And the second thing is whether the patient thinks that they can afford the treatment, the payment, right? So with the the first part, we step up and we took a lot of seminars so we can be much better at our communication with the patient, right? And the second part, the whether the patient thinks that they will be able to afford the treatment. We have tried different things. First thing is, first thing we tried was care credit. And that was very popular back then. Right? It's still popular. And the concern we have with care credit was that, those patients who don't have good credit score, they don't get qualified.
Oh, that's right.
Yeah. So, and we were like, the patients who were interested in payment options, those are usually the patients who don't have good credits, So I was like, that didn't seem to be working too well. And then we learned about compassionate finance, right? Compassionate finance, almost everybody will get qualified, right? As long as they have a bank account. But the concern with that was the interest was very high, right? We're talking about like 15%, 16% interest. And for those patients who have pretty good credit, they don't want to pay that interest, right? But then some of them, they still want to do like a monthly payment plan. So, and then at that point, we were like, should we offer both options to patients? I mean, and make it work. But then we were thinking, it's pretty complicated. We have patients who have to do like 2 applications, and then there's a lot more explaining for us to do, right?
That is time consuming. Yes, I've done a payment plan for other services in my life, and yeah, it was made easy for me with one option. I didn't even think about if you're doing care credit or compassionate that you have to go through the process for each of them.
That's correct, and then we knew that the more complicated we made it for the patient, the more likely they would say no. So I was like, wouldn't it be nice if we have like one platform and then, patient would just need to do one application and make it as easy for the patient as possible. That would be ideal. Yeah.
So how did you discover, or did you solve the problem for one platform where somebody could come in and make it easy, as close to a one click to AcceptCare as possible?
Yeah. So we were at the PDA meeting last year, I think. It was last September. And, during the break time, Cierra came to me and she was like, hey, they have this thing called AcceptCare. And I think we should find out more about it. And that's how we find out that, AcceptCare seems to be a good service for us to use. Sounds like a great service, a great solution for us, in terms of providing the more affordable financing options for patients. Yeah.
So was this September of 2023? So this is fairly new, or was it the September previous? Oh, Sierra's nodding her head for listeners. So this has been fairly new discovery for bringing in AcceptCare. This is like real-time case study happening.
Yes, actually, I was wrong. I think we learned about AcceptCare in March 2000.
Okay.
Mm-hmm. Yeah. Yes. So still fairly new. It hasn't even been a year yet. And I've been just blown away by the process. Everything has just been great.
Wow. So that's amazing. Okay. So you've discovered it in March and decided to bring it in. I'm going to slide a little bit over here, Dr. Liu, to Oliver, the CMO. of AcceptCare. And Oliver, welcome to our podcast. I think Edmund just told an excellent story of some of the issues that he was seeing from his patient's perspective. From your POV, what problems did you see in dentistry that kind of built up to this amazing product?
I love that story, and it's a picture perfect reason why we developed the product. I mean, the truth is the story behind AcceptCare, which is granted, many have probably not heard of it. It's a new and disruptive solution, but AcceptCare's story actually starts about 10 years ago when we developed and started a product in a company called OrthoFi, which was built for the orthodontic specialty. And it was the same mission. It was about increasing access to and acceptance of orthodontic treatment via good technology, great processes, and leveraging proven concepts around patient consumer behavior. And what's great is we were able to prove over 10 years of doing that that we could materially move case acceptance. That solution has started well over 1 million patients. And we've been able to generate over $5 billion of orthodontic production leveraging those principles. So a few years back, we started looking at could we do some great things in the general dentistry industry. And in our research, we found a lot of the things that Dr. Liu was talking about, where case acceptance is a little bit broken in general dentistry. Not in every practice, of course. There are a lot of practices that partner with great partners like PDA that are students of the game. But in a lot of practices, unfortunately, it's a little bit broken and disjointed. And so what we found is with the data is we saw that most practices get less than 50% of their cases accepted and get less than 35% of the dentistry that they recommend accepted, which was not acceptable to us. And so we knew that we had some great insights, a lot of data to bring, and some great tools that we could bring to the table to help solve this. And probably the biggest thing that we knew right off the bat that we could bring to dentistry is change this disjointed gauntlet of no process that exists today, where the average practice is typically presenting their fee options and their payment options in a trial and error binary yes and no sequence that gets a patient into a tidal wave of no that you then have to go and swim against the tide to get back yes. And we wanted to introduce our concept of open choice, which essentially it disrupts all of that. The other thing we knew we needed to solve is the thing Dr. Liu was talking about, which is, unfortunately, in the dental field, because of the need for cash flow, many practices have oriented their fee presentation concept around a lender. And I have no problem with lenders. We work with them. We'll talk hopefully a little bit about the concept of a network of lenders versus tying oneself to one lender. So we need lenders to get patients into financing, but it's not necessarily the best idea to build your fee presentation around the whims of a lender. And so, unfortunately, that also created that disjointed aspect where practices were pitching a painful option first, then putting a patient through an application process once they had said no, then they get declined, then having to then possibly default to another lender or an option like compassionate finance. So it's a gauntlet of no's. So a few years ago, we partnered with Bruce Baird and his company CFI that was already doing a lot of the same things from a mission that we were in orthodontics with compassionate finance. And we believe that we could pool our resources and create the ultimate case acceptance engine, which we call AcceptCare today. That's what it's all about.
Isn't it interesting? It takes a decade to become an overnight success. That is like the biggest cliche that I've heard, but time and time again, it's really proven true. It takes 10 years to know what you know and be able to shift it over. Also, I hope on all of your marketing collateral, you have overcome the tidal wave of no, because that's a great visual. I get why you're the CMO. It's very clever. So I love to put feelings out first and then have the data to back it up. So Oliver and Cierra, I'm going to go back to you in a second here. Edmund, if you could share with us, since implementing AcceptCare in the practice, how do you feel the results have been so far? Have you noticed it from a clinical perspective?
Oh, yes, for sure. We did notice a major difference in terms of case acceptance. A lot of the treatment planning that we do, more like the bigger treatment plan, we felt like, oh, patient is back, and before, one thing that we noticed was, we try so hard to educate the patient, and share with the patient that, like how they would benefit from the treatment we recommend. And then, and then I check with Cierra, hey, did the patient schedule? And it's like, oh, the patient said, I need to think about it. I need to talk to my wife or, talk to my spouse, and, it wasn't a good feeling. We felt defeated actually. But, after we started using AcceptCare, we definitely see a big change on that. Yeah.
That's wonderful. My old mentor, Skip Miller, he has done sales training for Google, like HP, Apple, all like the big tech companies. And one of the things he always told me was, yeses are good, no's are good. The maybes will kill you. And I think everybody listening, including myself, can remember a time when you have an option in front of you. It's maybe a bigger financial commitment than you were prepared for, and you sit and swirl in that kind of indecision area. And I love this so much just because of my own personal story. Is I remember the day when I was presented with a plan and I didn't even pay attention to how much it cost. The answer was yes. And they gave me an option that was a one-click option. And it was, I could do it all at once. And I didn't even ask, didn't have to go ask my spouse. Like, it was just an immediate yes. And that takes, I love, Edmund, you said, it's more than the financial component. It's how it all works together. It's from all the way external marketing through to how you communicate with the patient and over. So let's look at the data a little bit. So what did the numbers tell us about since implementing this? And then Cierra, I definitely am going to be curious about how easy it was to bring it in. Oliver, do you have numbers perhaps to share about Dr. Liu's practice and what's occurred from the data perspective?
Yeah, I absolutely do. And by the way, I appreciate Cierra and Dr. Liu providing us and being vulnerable and providing us with the data prior to AcceptCare so that we can make some good, pre and post comparisons. Probably, obviously, the product is called AcceptCare, so we'll start with case acceptance. At the end of the day, what we were able to see is, from Dr. Liu's office, they had cited that they were getting roughly 22 to 23% of their treatment dollars accepted prior to AcceptCare. And today, that number is sitting close to 60%. So what I love about that, just obviously on the whole, like that changes the whole dynamic of feeling defeated. What I want to do, though, is I want to break that up into a couple of components. And so the important part about case acceptance is, and you mentioned the whole, I have to go home and talk about it with my spouse. Some of the time, that's true. A lot of the time, that's basically a defense mechanism and a way to say no. So what we want to do with case acceptance is we want to tackle it into two pieces. A, we want to accept the number of times and the percentage of the time you get a same day yes, which I want to tell every practice, you have the permission to ask for a same day yes. So we were able to immediately, in an in-month rate, be able to get them from 22 to 44%. In terms of case acceptance. The other thing about AcceptCare, though, is it's not just a fee presentation tool on site. It also has a powerful patient pending management reminder system, automated text and email reminder system that stays with patients, because we know that practices struggle to find the time or find the confidence to follow up effectively with patients after fee presentations. And so what we've seen is that those numbers actually swell over the next 90 days. And so that the remaining climb, we see about 32% of the patients saying yes after 7 days after their exam. And we make it easy and they can do it from home. And so the remaining climb to that number, which is incredibly exciting, if you look at it that way, we've seen 150% increase in their case acceptance from that. And like I said, 2/3 of it is by increasing same-day acceptance, and the other third comes from getting more of the patients who have left the practice, who may legitimately have to talk to their spouse, saying yes. So that's the first part of the data. The other part that I'm also really excited about that Dr. Liu also touched on is the courage to present comprehensive care. What we've also seen is over the last 4 or 5 months, we've seen a steady increase in the average treatment amount accepted, and which is what it's all about. So we not only want to increase the hit rate, but also how much treatment patients are able to accept that they need, right? It's not about overselling. It's about getting patients connected to the care that they desperately need.
Doesn't it, Dr. Liu, doesn't it make you feel good in your heart to see not just the data reflect the accuracy of it, but the impact that you're making in the community to go below the surface problem so that, you're addressing the root concerns and coming up with these acceptance to comprehensive care plans? I mean, it's a moment to take a pause, because this is, I think, why we're all in healthcare. We want to make people healthy. We want to give them ways so that they can be healthy. So that has to feel good for you.
Yes, it feels great. It feels great that we know that we are taking good care of the patient, and then also they are able to let us take care of them.
Cierra, if I was you, especially as wellness coordinator, I'd be jumping out of my skin, probably because I get a little bit competitive sometimes, but you probably see these numbers on a daily basis and you interact with patients. So I saw you kind of get excited, and that's a big climb. So congratulations on that. That's huge. Can you walk us through how it was to bring AcceptCare into the practice from your perspective, and what this has been like for you as an office lead and wellness coordinator?
Yes, I absolutely loved it. When we did the PDA and they were reviewing the slides, I was whispering to the assistant, I'm like, I'm signing up. I'm going to talk to the doctors, but I'm signing up, because this is exactly what we have to have. Because it's I just felt like everything that we kept trying, it's just, I felt like that was just, we hit a wall. And I'm like, okay, something's got to change. We have to go with the times. And being that, so much stuff is electronic now, AcceptCare is set up to be electronic. We know that people always have their phones in their hands. They're always checking their text messages. When they get an email, they want to see who emailed them. And the fact that AcceptCare are sending those reminders so consistently, it's hey, don't forget. Because it's a lot of times they leave the dental office and they're like, forget that, I'll think about it. And then it leaves their brain. One thing that we always say is it takes 3 times. They need to hear something 3 times. So,
yep.
In the back, they hear it in the front. But it's when they go home, they're going to get it. They're going to hear it again. And sometimes when you're home and you're in that comfortable spot and you're no longer in that office where you already probably felt uncomfortable, because of course, as they always say, nobody likes to come to the dentist. So it's now you're at home, you're on your couch, you're relaxing, and then you get that pop-up and you're clicking the link, you're looking at it, and you're like, oh, okay, yes, I do need this. I do need this treatment. So I'm just over the moon excited that when we brought it in, doing the Zoom call, it was an easy setup. It was, they go through everything as far as what it looks like, what's expected. It was the easy transition. And I think it's Einstein that says the definition of insanity is doing the same thing over and over, expecting the same result. And so I feel when we were actually able to get the AcceptCare in, it's okay, this is something different. We're changing, because I felt with the paper and just going over the same things over and over and over again. And, we try to fine tune our verbiage. We fine tuned, the handoffs. We fine tuned every little thing that we could possibly do to make ourselves better as a practice. And it still felt like there was just something missing when it came to the case acceptance. And not just because it's my office, but these people are absolutely an amazing team, amazing assistants, amazing hygienists, amazing doctors in front office. So it's like, okay, if we know that we're doing all that we can, we're great, what's missing. And so when we brought the AcceptCare in, it took off. I told everybody, it takes 30 days to make a change, 30 days to create a habit, 30 days to break one. So let's give this at least 30 days to really put our all into it and try to figure it out and navigate it and see what we can do to fine tune it. The great thing about the process is us being able to communicate with the AcceptCare team constantly of what's working and what's not working. Could we change this with this benefit? And just having them be so supportive in those changes has really helped, I think, on both sides, both AcceptCare and our office as a team. And it's been a great experience. And just to be able to see the numbers and see the email pop up that says a case has been accepted when, I'm like, oh, ooh, look, so-and-so accepted their treatment. I'm going to call them so we can schedule. It just really amps up the flow of the office and it just brings in so many good vibes. So I love AcceptCare. That's all I have to say. It's great.
I did not expect on this podcast to see this demonstration of leadership. So you just blew me away, Cierra. Dr. Liu, I don't even have to ask you. I know how lucky you probably feel to have Cierra on your team. And you just highlighted, Cierra, the power of a team environment and the power of knowing your controlling idea. And really that had to feel amazing to go from, you fine-tuned everything. You're still probably frustrated or just even optimistic. Like, what else could I do to get that number to move up from 20% to finding the solution and being brave? I hope listeners, I hope you all really sit with yourselves for a second and think about your own wellness coordinators and front office leads. Are you providing them the space, the safety, the confidence to really be able to explore options for the practice that they know that they can bring from their unique perspective to plug in and help? Because it's not all on the owner doctor's responsibility. It's not all on their shoulders. And when you have a team that's really fine-tuned and aligned, I think this is exactly a fantastic example of the result of that. Cierra, you just blew me away. What kind of questions do you think doctors are asking themselves perhaps, or what should they be asking themselves if they are considering if AcceptCare is right for them?
Yeah, so I would say, just to touch on the doctor side of it as well, our doctors are definitely amazing at just hearing the opinions or alternatives. One thing that they had me do that I would tell anybody as far as, treatment coordinators that are listening, is to create a this versus this. What are you currently doing that you're having pros and cons with? Versus what can AcceptCare give you pros and cons list as well? And that's something that I developed for the doctors and sat down and was able to show them, this is what we are currently trying to figure out. This is our pros and cons. I've had the Zoom call with the AcceptCare. This is what they can do. And here's, the two different sides of it. And just them being open and receptive, I think is huge. So questions that I would say as far as that would go is just being able to ask yourself, can you repeat the question one more time? And then
Yes, I can. Ricky, edit Cierra kindly. You did great though. The question was, what kind of questions should doctors be asking themselves when they are considering bringing in AcceptCare?
I would ask them, I think one of the biggest things is, are you feeling defeated at work? Are you feeling like where you're at right now is just not at a good place when it comes to the acceptance? Because I feel like when the questions as far as like the AcceptCare goes is, if there's something that you should bring in, what do you have to lose? Is what you're using right now currently working, that you're having to question, your verbiage or your dentistry? You're having to question, the patients or question your team. Are they not doing what they're supposed to be doing? It's like sometimes we try to pinpoint a target of what is it or who is it that's not getting us the yes. And sometimes we have to look outside of that and get out of the habit of the consistency of well, this is what we have. This is what we signed up with. This is what we're going to use. Yes, we may have signed up. Yes, we may have tried that, but maybe that's not working. And I think being open to change and being receptive to the fact that what you have may not be working. So what do you have to lose? I told Dr. Liu the other day, instead of saying what's the worst that can happen, what's the best that can happen? The best that can happen of trying AcceptCare is that you get case acceptance, that your numbers are going up, patients are saying yes. And so I think that's the biggest thing is what's the best that can happen if you try AcceptCare? And I can promise you the best that can happen is your case acceptance will most definitely go up. So I think it will be the best decision for you to try.
Cierra, I want to have coffee with you, and whichever next PDA workshop you're coming to, let me know because I will get you a coffee. Victoria Peterson, our CEO and co-founder, she has always talked about respect being the willingness to take a second look. And I think when you combine that with the optimistic question of, is it good enough? Is it worth that second look? I remember, throughout my 20 plus years in my career, I once worked for someone who said, good enough is good enough. It doesn't have to be great. And it was supposed to be an inspirational speech. And as soon as I heard it, I knew this is not the organization for me. And it wasn't bad. It just showed me that I love taking a second look. And and I do the same thing. I say, what is the best that can happen? And then what's the very worst that can happen? And if the risks are, well balanced, like, let's go ahead and try it. So Dr. Liu and Cierra, other than the financial and improved health of your patients, which we know we have great numbers on both of those, were there some surprising but maybe less obvious results that you experienced from implementing AcceptCare?
I would say from my point of view as a front office, I noticed a lot more just unity, even within the front as well, because when we were printing the treatment plans out, and it's like a foreign language to the patients, and a lot of times they just felt, I would notice the front would feel, defeated at times, feeling like, they feel in their heart like, oh, yes, I got this. And it's like when you put that paper in front of them and you get that, instant blank stare of, I have no idea what I'm looking at, it does feel kind of defeating. And so I think with the AcceptCare, with it being electronic and the patients are more in control, I've seen more confidence come from the front office as well. And I've just watched, everybody in the front, including myself, just excel and feeling confident when they're presenting the treatment to the patient and just kind of passing it over to them. And just noticing that, we're excited together when we see a patient sign up, or we're giving each other little fist pounds like, yes, good job. Like, I'm excited, because it's more about than just getting the acceptance, but knowing deep down, like, that this is going to change the patient's life. And it's just a win-win on the case acceptance and a win on knowing that this is going to change the patient. So I think that that's been something that has just been amazing.
For sure. Financially, definitely, it's been helping us a lot. However, the other thing that I think is worth mentioning is how much more AcceptCare has made our team happier, especially the admin team. None of us are working in the dental office to be a banker, right? and I could feel that, before, when we were presenting the treatment option, the payment options, with a piece of paper, I could feel that my admin team member were very uncomfortable, no matter how many times they have practiced it or how many times they have, presented them that way. They just didn't like it, and it's not a good feeling when I know that my team members are doing something that they don't feel comfortable or they enjoy. But the changes from the piece of paper to having everything on the iPad, Cierra and Jolman and all my admin team members, they share with me that they were just so much more comfortable doing it. Yeah, and the patient also feel more comfortable when, like Cierra said, when they know that they are in control. It's their information. It's very easy to understand. You just look at it and you just do a few clicks, and and it just makes everything so much easier.
Thank you. It's really hitting on a personal mission of the reality that dentists go into dentistry wanting to make a positive impact in the lives of others, and they might be super nerdy about oral health or dentistry in general. Like, who knows? They might be teeth artists, whatever the case is. To me, it definitely hits my heart when they get into business ownership and realize all of the additional duties that come along with it. And you shouldn't have to be a banker. You shouldn't have to worry about all of these little, details so that it really, because over time it can impact your dentistry and how you feel about the dental practice and your whole entire career. So to get it fine tuned like this, it takes intention. It takes that willingness to keep looking, not giving up. And Oliver, since you're overnight, I'm saying overnight success just because this is the first time you're on my podcast. After a decade, and as you've been growing, when you look out on the horizon and the future of our industry, what are you seeing next? What problems do you see that you kind of have a passion for solving?
We're gonna stay within our mission around increasing case acceptance, increasing access to care. That said, increasing access to care involves a lot more things than just fee presentation. So when we plot out the patient journey from call to a consult to contract and to collection, we want to help in all those phases. And in the orthodontic field, we do a lot more of that flow. And again, we're trying to bring all of our learning. So as we expand to cover more of that patient journey, again, to try to maximize case acceptance, that's where we're going. And the first thing we're going to do is just getting case acceptance is great, and getting patients to pay depending on how they pay. Sometimes they pay in full, which is easy and great. Sometimes they go through third-party financing, but sometimes they do what has been very popular at Clarksburg Dental, which is making some short-term payment plans, which then puts some burden on the practice to get collection. So we have some proven technologies with our Bella product that we're going to be able to incorporate more in a more connected way into AcceptCare, which we plan on launching early next year. We're going to call that AcceptCare Plus. But there's a lot more to that patient journey. Even thinking about, how do we make sure that patients' insurance is verified and accepted as quickly as possible on site, to then lubricate that process even better and make sure that they know how much coverage they have in real time. All of these things that little by little accumulate to a fantastic and seamless case acceptance journey.
Well, I look forward to having you all back again after AcceptCare Plus, perhaps. I have a feeling that Dr. Liu might put that in his office as well, and have a checkup and see how it's going, maybe a year from now. Dr. Liu, is there anything else you would like doctors to know about bringing in this type of support?
Well, yeah, I want to share that I have, me and Cierra, we have no financial interest in the company. We were really trying to sell their product, but no, we just love the product. We feel like it's the best service, available right now on the market in terms of providing payment options for patients. Yeah.
Thank you, Dr. Liu, Cierra, and Oliver, especially for, as Oliver said, your vulnerability, your transparency in sharing your journey and your numbers, everything along the way. I know this is going to be impactful for others, and they deserve to know that this exists. So thank you for being guests on our show today. And I wish you well, and I look forward to seeing you in 2024. I'm going to make it my mission.
Thank you for listening to another episode of Everyday Practices Podcast. Chad and I are here every week thanks to our community of listeners just like you, and we'd love your help. It would mean the world if you can help spread the word by sharing this episode with a fellow dentist and leave us a review on iTunes or Spotify. Do you have an extraordinary story you'd like to share or feedback on how we can make this podcast even more awesome? Drop us an email at podcast@productivedentist.com. And don't forget to check out our other podcasts from Productive Dentist Academy at productivedentist.com/podcasts. See you next week.